What happens after a cesarean section? Find out what to expect when you are in hospital after a cesarean section, including side effects, pain relief, and when you can go home. After your cesarean section operation, you will be moved from the operating table onto a bed. You and your baby will be taken to a small ward, which is sometimes called the recovery room. You can continue having skin-to-skin contact with your baby while you are in the recovery room. Your midwife will help you find a comfortable position for putting your baby to the breast. If you and your baby are well, you will move to the postnatal ward after a few hours. In the recovery area and on the postnatal ward, you will have many issues. The first, regular checks to make sure the anesthetic is wearing off. Your midwife will also check your breathing, heart rate, blood pressure, wound dressing, and pain relief for the first few hours. The second, regular checks on the amount of vaginal bleeding you have. The midwife will also make sure you are changing your maternity pads regularly. The third, a catheter to drain urine from your bladder. Your midwife will check you have passed enough urine within 6 hours and will take the catheter out about 12 hours after the operation once you are up and moving around. The fourth, compression stockings to reduce your risk of blood clots. The fifth issue and the final is a needle in your arm drip, what's called a drip, to give you fluids until you are eating and drinking again. You can usually eat and drink as soon as you feel ready. Recovery from surgery. The speed of recovery from cesarean section varies from woman to woman. There are many things that can affect your recovery, such as the type of cesarean section you had, but all cesarean sections are major surgery and you will need help with lifting your baby and getting out of bed for at least the first day. You will need to stay in bed until the anesthetic wears off. If you had a spinal or epidural anesthetic, this usually takes a few hours. It will take longer if you had a general anesthetic. While you are in bed, you won't be able to pick up your baby, and so you will need help with feeding and nappy changing. If you need help, you can press a call button attached to your bed in almost all of the hospitals. You will need help to sit up in bed while you are recovering from the anesthetic. You may need help for longer than this if you have a lot of pain or tenderness in your abdomen, tummy area. Your hospital bed will have controls which you can use to raise and lower the head of the bed and move the bed higher or lower off the floor. So now we need to talk about post-operation pain relief. Your wound is likely to feel sore and bruising for a few days or weeks. Your midwife may give you paracetamol or non-steroidal anti-inflammatory drugs such as ibuprofen or diclofenac to relieve pain. Non-steroidal anti-inflammatory drugs may cause stomach problems, but taking them with food should help. Please tell your midwife if you think your pain relief is causing any side effects. If you are still having pain, your midwife may offer you a more powerful opioid or more powerful painkillers, such as opioids or morphine, for example. These painkillers can make some people feel drowsy and sick. If this happens, your midwife will give you a different type of pain relief. So, to help control any pain, take your pain relief regularly and on time. even if you don't have pain at the moment. And tell the midwife straight away if you are still having pain. The amount of pain relief recommended by your midwife or doctor should be safe for you to take while you are breastfeeding. A small amounts of any medicine you take may pass into your breast milk, but they are unlikely to harm your baby if you take them as instructed. However, some drugs which contain codeine may be harmful for your baby. Always check with your doctor or midwife or pharmacist before taking any medicines. Your midwife may give you painkillers to take at home, such as paracetamol or ibuprofen. So we have finished most of what we have after cesarean section, but we are in need to talk about the wound, your cesarean section wound. You will have a waterproof dressing covering your wound. Your midwife may ask you to take the dressing off 24 hours after your cesarean section so they can check your wound. Many women find it easiest to do this in the shower because the warm water helps to reduce any discomfort. You may not need another dressing, but if you do, your midwife will remove it when they visit you at home. Once your dressing have been removed, congratulations, keep your wound clean using plain water. Avoid using soap and pat the area dry gently with a soft towel rather than rubbing. You may find it more comfortable to wear loose clothes and cotton pants that sit above your wound. Your wound is closed and either stitches or clips. Some women have stitches that dissolve once the wound has healed. Otherwise, your midwife will remove the stitches or clips when they visit you at home about 5 to 7 days after your cesarean section. Getting up and moving around. Oh, this is the most amazing step. Once the anesthetic has worn off, you will be able to stand and go for a short walk. You are likely to feel wobbly the first time you get up, and you will still have your catheter. So you will need a midwife to help you. Your abdomen, tummy area may feel tender and heavy. Your midwife can give you some pain relief beforehand to make you more comfortable. It's important to move around soon after your cesarean section to reduce the risk of blood clots. Other ways of reducing this risk include 3 important tips. The first one, drinking plenty of fluids. The second one, wearing compression stockings. The third one is having a daily injection of blood thinning. In some cases, after surgery, your midwife will tell you if you need this and for how long. Only use medical compression stockings that your midwife has given you. They will measure your lower legs to make sure the stockings fit you properly. You will need to wear the stockings day and night for as long as your midwife advises, only taking them off to shower. Your catheter will be taken out about 12 hours after your operation. As long as you have been able to get out of bed, this feels uncomfortable, but it is not painful. Once your catheter is out, you will be able to walk to the toilet and have a shower. It can be a good idea to ask someone to walk to the bathroom with you the first time in case you feel unsteady or on your feet. Your midwife will encourage you to drink plenty of fluids after your catheter is removed. They may ask you to measure the amount of urine you pass the first couple of times you go to the toilet to check you don't have any bladder problems. Tell your midwife if you have any discomfort when you pass urine. The bathrooms are usually large enough for you to take your baby cots in with you. If you don't have someone to look after your baby while you wash, some hospital showers have seats, which can be helpful if you find it difficult to stand for very long. Don't worry about getting your wound dressing wet. They are waterproof, so your wound will stay dry. Vaginal bleeding is normal after cesarean section. It lasts for 2 to 6 weeks after birth and mainly comes from where the placenta was attached to the womb. Draped wind and constipation. This is one of the most difficult issues the woman could experience after cesarean section. It can take a few hours or days after your C-section for your bowel to start working again. In some women, this can cause painful draped wind and constipation. Some pain medicines can also cause constipation. Chewing gum may help to get your bowel working and help you feel more comfortable. Some women say that peppermint tea helps to relieve draped wind. Drinking prawn juice may help with constipation. To help you manage constipation, drink 6 to 8 cups of water a day. Eat regular meals. Don't put off going to the toilet and give yourself plenty of time to go. When you are sitting on the toilet, put your feet on a footstool or a pillow of box. Move around as much as you can. Your baby after cesarean section. Oh, the second person and the hero in this all. As long as you are both well, you and your baby will stay together on the postnatal ward after your cesarean section. This is an important time for you and your partner to bond with your baby. For example, by having skin-to-skin contact. Your baby may cough up mucus in the first few days after your C-section. Mucus is usually pushed out of the baby's lungs during a vaginal delivery, but this doesn't happen during cesarean section. The mucus can make it harder for your baby to feed and it can be worrying for you, but it is normal and should get better after a few days. When can I go home? Oh, this is the most great question. You will usually stay in hospital for between 2 and 4 days. If you and your baby are well, you have someone to help you at home, you may be able to go home after 24 hours. You may not feel ready to go home, especially if this is your first baby or if you or your baby have needed extra help. Your hospital midwife will help you with any problems you may be having and may be able to put your mind at rest. Once you are home, you will have support from your community midwife and your health visitor. The midwife will visit you the day after you get home. They will visit again 5 to 7 days after your C-section to remove your stitches and clips and check how you and your baby are doing. They will let you know how often they will visit and when they expect to discharge you from their care. You will also have support from your health visitor. They may visit you at home to begin with. then you will usually visit them at a regular clinic. Your midwife or health visitor can put you in touch with other parents and local support groups. When you leave the hospital with your baby, someone else should drive you home. If you don't have any family or friends who can take you, book a taxi. You shouldn't drive until you have recovered. Don't forget your baby's car seat. Preventing blood clots. Finally, before you leave hospital, your midwife gave you a supply of blood thinning drugs to reduce your risk of blood clots. This may happen in some cases according to your medical situation. You may have had injections of this drug such each day since your C-section. The midwife will show you how to inject yourself. You will need to have the injections once a day for about a week after your cesarean section. If you have a higher risk of blood clots, you may need to have the injections for up to 6 weeks. If you are worried about doing the injections yourself, you can ask a family member or friend to do it for you, but they will need to be available to give you the injection at the same time each day. Finally, we have reached the end of our video today. Wish you all the best, and for you and for your baby, have a most beautiful and amazing experience in your life. See you in the next video.